The good thing is that the research is out there and it's very clear that links oral health to systemic health, right? You have diseases like cardiovascular diseases and hypertension,
Yes.
diabetes, that all have oral manifestations.
Perhaps you can give us some insight as to why you have decided to not only go to dental school, but also to get involved with the law profession. And somewhere in there has to be a notion that you're doing this to advance public-private partnerships and health in general in connection with bringing the profession and the dental profession and the law profession together.
In regards to my entrance into law, it actually stems from my experiences in undergrad at the University of Michigan. So I was involved in a global healthcare nonprofit, and to keep it brief, after my experience, I realized that I want to help bridge the gap between those who can and those who cannot afford care. So I came into dental school with that perspective in mind, and it was actually my involvement in ASDA and organized dentistry that really exposed me to healthcare and health policy and really showed me where the gaps lie. And so I realized that policy is the best way we can have that systemic impact, which is what inspired me to pursue the master's in law, which I'm currently doing at Penn. So I've been grateful to study both dentistry and law. It's taught me various things. For example, dentistry is a profession that's driven largely by state law. And so that's, I think, one thing we can leverage in organized dentistry and spend a lot of our advocacy and lobbying resources at the state level. So it's taught me so much, and I look forward to continuing my education in dentistry and law.
Wow, that's terrific. And we need to move public policy from taking care of people that are sick to preventing people from getting sick. What are your thoughts on the whole idea of systemic health as it relates to dentistry?
Yeah, I think that's a very important question to ask, and I'm glad you do so. The good thing is that the research is out there and it's very clear that links oral health to systemic health, right? You have diseases like cardiovascular diseases and hypertension,
Yes.
diabetes, that all have oral manifestations. Yes. And then the even more relevant part is that dentists, they see patients on a more regular basis oftentimes than their primary care counterparts. And so that puts dentists in a very unique position to be able to screen patients on a regular basis and to potentially lead to early recognition and diagnoses and eventually earlier prevention as well. So I think that link is very important, and I do think that dentists have an important role to play in primary care fields, such as blood pressure screenings, for example. And so I think that's a great point. I do think we would need some more policy support to expand the scope of dental practice and eventually some pilot programs to be able to get out into the dental practices and understand the feasibility of this and the cost effectiveness of this and ultimately patient outcomes. But definitely a feasible outcome in my opinion.
Well, the career you've chosen is one of understanding public policy with a clear clinical understanding and research understanding from your experience at Penn Dental. So I think you will be ideally positioned to help close that gap between access to care and those that do not have access to care. And the way to do that, I think, is to connect the two, the human body with the mouth, put the mouth back in the human body, as they say.
Yep.
And your research or the work you're going to do at Michigan in public health, I think, will get you much closer to understanding what needs to get done, which leads me to my next question is, how do you rally the dentists of tomorrow to understand your philosophy?
Yeah, that's a very important question, and I get that asked quite often. I think the first thing I always point to is education. You have to first learn about the space that you're seeking to learn in. And so online resources are abundant, but ASDA is a great resource as well, and every individual school has an ASDA chapter. And so they can get involved and attend advocacy events where our local leaders show students what it means to be an advocate in the dental field, what that entails of, what are the issues that we're fighting for, and what are the impacts that leads to. So once you're educated, then I think you can go on, and I think the best tangible way you can get involved is to speak with your legislators. Speak with your legislators. I mentioned that state law is what really drives dental regulations. So if you could speak to your state legislators, I think that goes a long way. And if you think about it, our lawmakers, their expertise lies in exactly that, which is passing and making laws. Our expertise as dental students and future leaders of the profession lies in dentistry and all the issues within that. And so I think we have a responsibility to educate our legislators and share our stories so that way they can then make an educated decision. So that's what I would recommend the upcoming generation of dental leaders.
Well, with your background, the clinical background, the public policy background, your undergrad, all of that, you are well positioned to be an important leader in advancing access to oral care, to ensure that we prevent people from getting sick, and to connect with the other parts of healthcare. So, Sam, it's really been an honor to interview you, to spend time with you. I can't wait to continue to follow your career. I think you're going to make a huge impact on oral care as a driver of healthcare in general. You're well positioned. I'm glad you are going to continue with your studies in public health. There'll be lots of opportunity to actually get more involved in the clinical side, but with your extra studies in this field of public health, you are going to be well positioned to help drive the agenda of oral care and healthcare in general. So thank you, Sam, for
Thank you,
meeting with
Stan.
us.
The pleasure has been all mine. It's truly been an honor.
Right.
Appreciate it.
Look forward to staying in touch.
Thank you.
Thanks, Sam. Good luck.
Thank you.
Thanks.